Hi everybody, my name's Crystal and this is my first YouTube video, and I have classic Hodgkins lymphoma cancer. That's cancer, and I'm stage 3, and I've gotten so much help from the YouTube videos that I thought maybe I could help someone by doing a video. So I'm 40 years old, and I started having problems around January of this year. It's now June 2nd. Yeah, it's June 2nd, 2013. So I was having a lot of problems at work and stressed out and everything, and we were cleaning, and I cut my hands up while I was cleaning, and I got an infection, and my neck started to swell up after a couple weeks. It was just one thing after another, so my neck swelled up, and it was from down here, from my shoulder up to my ear, from my hairline to my face, and it was so big it was making my ears crooked. So I went to the hospital, I went to urgent care, I went to doctor's appointments, and they gave me antibiotic on top of antibiotic on top of antibiotic. So after about 6 10-day treatments of antibiotics, the doctor decided to do an emergency surgery because I was in so much pain. I can't keep my bandage on. I was in so much pain that it had just about, I would be in so much pain. On a scale of 1 to 10, I was like at an 8. And with the medicine, I would only come down to maybe a 3. And the pain was starting to drive me crazy. So I became depressed. And I would lay in the bed for days, sleep for days, and I didn't know what was going on. I know now that a lot of that fatigue was a symptom of my disease. But I became clinically depressed, and so they gave me medicine for that, which I love. I'm ready to do a commercial. I absolutely love it. And it made things more bearable for me. I looked at things differently once I got the medicine. So anyway, after about 2 weeks after my surgery, they took a piece of my lymph node and they sent that away for tests. So after those tests came back, I had classic Hodgkins lymphoma. Never really, I think the diagnosis was an answer, so to me it never really was, oh God, I got cancer. It was more, okay, now what do we do to fix it? So my symptoms that I experienced, fatigue is my number one thing. I get so tired, and the more I overdo it. So if I don't sit down or rest or listen to my body, I get so tired. I get dizzy. I get so tired I'm dizzy, and I'm starting to itch a lot more. I didn't recognize it at first. I remember a couple months ago, I had stripped my bed down and washed all the pillows and the comforters. I thought I had bed bugs. I was itching so bad. And so yeah, I know now that was some itching now. So I hope that the symptoms from my disease will stop once the chemo starts, and then I'll just have to deal with the chemo symptoms. But yeah, so those are the only, and I do get night sweats, but only around my neck. where the cancer is really concentrated is in my neck. So at night, the only place that I really sweat, my neck is always wet, but not my whole body. So I don't have the complete night sweats. It's just in my neck. And let's see what else. I don't know if it's I don't really drink. I'll have a drink here and there, but I never got any symptoms from that. And what else? Those are the only symptoms that I really had, was the itching, but the fatigue is really, really bad for me. The fatigue and the little itching. That's it. So yeah. And my lymph nodes, they swell up. And then they go back down. And they swell up and they go back down. This one is really big. Yeah. That's the bad one. And there's some back here, and they come up and they go down, and they're painful just to touch. If I don't touch them, then they don't hurt. So yeah. During my surgery, they nicked the nerve, and I couldn't feel my ear, so the feeling's coming back in my ear. I can barely feel it, but I can't feel it. I could wear those big earrings now that I never could keep on all day because I can't feel it. It's hard to answer the phone too because I can't find my ear. But it's coming back. So yeah. So I got my hair all pinned up because I'm ready to go to bed. It's probably 2 o'clock in the morning. Yeah. So I take those naps and then I'm up all night. Can't stay up all day, but I'll stay up all night. And then I'm no good in the morning. So yeah. So tomorrow's my treatment. And my first treatment. So I'm going to make another video after I do my first treatment. And I'll let you know how everything went. Yeah. I feel so crazy like I'm talking to myself. No bats in the cave. I just crack myself up. I pull over sometimes to laugh at myself. You gotta laugh at yourself. My hair is so cute today. I'm a hairstylist. So I'm a little meticulous about hair. That's the one good thing about, well, they said my hair may or may not fall out. But I don't even care. You know, I got drawers and drawers of hair. So that's never been a problem. I can't even remember seeing a picture of me with the same hairstyle twice, so I'll just put on some hair, you know. I gotta thin this side out some. I got pins in it trying to keep it down low. So yeah. So I get that from YouTube. So yeah, okay. So this is my first video, and hope you guys will watch. And I'll see you tomorrow. Bye-bye.